Hi, I'm Frank Spear. I want to welcome you to this segment. This is part 6 in our ongoing series on anterior temporization. What I'd like to talk to you about in this segment is the kind of refinement of tooth form. We've gone through basically the embrasure form to a large extent, but I just want to kind of review some things about natural tooth form and then also talk about facial surface morphology. I find it very helpful to look at extracted teeth when I'm trying to remember how to carve temporaries. So here's a photograph of 4 extracted central incisors. And I'd just like you to realize a few things about what exists in nature that we should see in our temporaries. Number 1, on a central, the mesial surface is basically a straight surface that goes smoothly into the root of the tooth. The distal always has a convexity to it. That makes the incisal embrasure always bigger on the distal than it is on the mesial. In addition, if we look at the incisal edge is basically perpendicular to the long axis of the root. As we look from a incisal view, we notice that in fact the distal line angle is always a more gradual, more rounded line angle, whereas the mesial is more acute. And in addition to that, if we look at the facial surface, it's actually fairly flat. It's a flat surface with some anatomy on it that then flows into those line angles on each side. The lingual surface actually has a curvature to it because it flows into the marginal ridges on the lingual surface. And the natural anterior teeth are very tapered to their lingual, which helps them to look slender. And you'll see from the incisal view or from a facial view in just a second the other thing that helps them look quite slender. So we want to keep in mind this is what natural teeth actually look like, natural central incisors. And then finally, from an interproximal point of view, the typical tooth, Sheldon Stein used to talk about it having 3 planes: the emergence plane, the body, and the incisal plane that tips back. And what's interesting is in natural anterior teeth, if you were to bisect the root with a line, you'd see that the incisal edge is directly over the middle of the root buccolingually because these 3 planes tip the tooth back. It's also important to remember that the emergence profile really isn't a big bulbous place. It's a nice gentle plane that comes off the CEJ. The other thing to remember is the lingual surfaces are concave, they're not straight. We need to put those concavities back for a number of reasons, not just for how they should look, but for occlusal reasons and phonetic reasons. And then the other thing you want to do if you want your teeth to look natural is make sure that the incisal edge is slightly beveled like that. It makes the tooth look very slender because you can only see the labial incisal corner. If you ever adjust the length of your teeth and make the incisal edge flat, it'll look really thick to you because you can see the whole incisal edge. So what we're going to do is just show you an example of what I mean by your temporary should replicate the tooth form you'd like in the final. Is obviously this 3-unit bridge doesn't look like natural teeth to me. We're going to take off the old restorations, re-prepare the teeth, make an impression, pour it in stone, and I'm going to go in stone and carve my ovate pontic site I want and make my temporary. And I'm then going to carve the ridge so my temporary will sit in the ridge. And what it will do is the shape of the temporary will then actually create the shape of the ovate pontic site in the ridge, and then we'll make an impression of that for the laboratory. So this is what the ovate pontic site looked like after the temporary had been in for about a month. But what I really want you to look at is the form of the temporary. We want to try and put back the natural form, the natural facial surface. So when you compare the natural form of the lateral incisor on the right, we should see a similar form to our lateral incisor on the left. And the 2 centrals should have the mesial straight, the distals convex, the facial surfaces having the emergence plane, the facial plane, and then tipping back. And then here's the final restoration in this patient. So let me show you how that actually occurs in terms of the laboratory. So we've looked at a lot of the different burrs, but the 2 burrs I'm going to use in this segment is the small fine carbide that you see circled there in green, and then I'm also going to use that medium one, the round tip, to put some anatomy in. So we left the temporary in our last segment at that phase, And here's using that finer grit carbide to create that distal convexity and also to start creating those planes in the surface, just refining them. There's a gray pre-polishing wheel. It's a rubber wheel from Brasseler I'm using to put the concavity in the lingual surface, straight lab handpiece. I'm also using it to put that bevel on the incisal edge. And then here's that medium carbide, and I'm using it to put concavity, if you will, the lobes in the facial surface. So I then create that same carbide and I move it back and forth to kind of gently spread those lobes out so they're not distinct little indentations. And really, getting the temporary to this point pretty much gets it ready to then be polished. We've done all of our other work to this point. And as far as polishing the temporary, I do it using a lathe and number 3 lab pumice on a very wet rag wheel, slow speed, and just keep it moving across there. We then follow that up with Ivoclar polishing paste and a dry rag wheel. Again, typically at slow speed. And that's how we get our final surface finish on the temporary. And so what you see in terms of the final temporary form, the facial anatomy and surface finish came from the steps I showed you in this segment. You also can see when it went back on the dentiform, remember it was made from an alginate impression of the preps, silicone model was injected, Loda matrix seated on the silicone model, and you can tell it fits actually very, very nicely. You can see the facial anatomy, the way the light reflects off of it from what we did with that treatment with the burrs right there. There's the lingual concavity that's placed, and obviously you have to pay attention in the mouth to occlusion when you do that. So you have to have your centric stop and then you get your guidance. But we don't want flat surfaces or convex surfaces. We want convex lingual surfaces. And there you can kind of see the form of the temporary itself. The way the light reflects off the facial surface gives you an idea of the luster that comes from the pumice and comes from the Ivoclar polishing paste. Now there's still some tricks we haven't talked about yet. Often I stain my temporaries to try out shades for patients. So in an upcoming segment we're going to talk about that. We haven't talked about temporary cements yet. We haven't talked about how to remove temporaries yet. So there's a number of things left in our series. But that at least shows you how this temporary was completed in terms of its final facial anatomy. Again, I've enjoyed sharing this series with you up to this point, and I'll look forward to seeing you in the next one.